Dr. Paul Gittens. I'm the Director of Centers for Sexual Medicine in Manhattan, New York, as well as Philadelphia, Pennsylvania. I'm also a board-certified urologist and clinical associate professor of urology and OBGYN at Drexel University here in Philadelphia. Today, what I wanted to talk to you about is how to maintain your sexual wellness. And so what we're going to do is I'm going to kind of start it with just talking about some health disparities that African American men have. We're going to go into some topics like erectile dysfunction, low testosterone, and what I plan to do is give you some tips in terms of how to improve or enhance your own sexual function. And also, hopefully, by doing those things, we can make you a little bit healthier. All right, so when we talk about African American men, unfortunately, when we look at healthcare statistics, African American men are usually kind of at the bottom. So, you know, as African American men, our statistics in terms of healthcare, for a number of reasons, either healthcare disparities, problems with just being educated about healthcare, access to health, are on the lower end, and because of that, we have higher rates of medical problems. All right, so when you look at Black men and you look at life expectancy, so how long we live, it's much lower than our white counterparts. If an African American is to have a heart attack, all right, we're about 20% more likely to die of that heart attack when we are compared to white men. Diabetes, as you know, is rampant in the African American community. And if an African American is to have diabetes, we're almost 3 times more likely to have an amputation of a limb, to have some of the other problems associated with diabetes. When you look at stroke, if an African American male is to have a stroke, we're 3 times more likely to die of that stroke or the complications of it. And then finally, with cancer, if it's either prostate cancer, colon cancer, what have you, we're 40% more likely to die of that cancer as opposed to as opposed to white males. So why do I care, right? So Dr. Gittens, you said you were a urologist and sexual medicine specialist, and that's true. In my practice, we deal with a host of sexual dysfunction for men and for women. For women, we deal with problems with orgasm, problems after menopause, problems with low sexual desire. For men, issues with male infertility, vasectomy reversal. But there's 2 topics, low testosterone and erectile dysfunction, I really want to highlight. And these are areas where I get the most questions about. Some of these questions I get in my office. I guess the 2 most common questions are, Doc, especially this is for when males come in, Doc, how do I improve my natural erections? As well as how can I increase my testosterone? And these usually are formed because these guys have seen things on TV or ads that are on the radio saying you can improve your erections by doing this or taking this. And I'll tell you as a physician that there's ways that you can do this and improve your erections and increase your testosterone without taking supplements or doing some of these other crazy things that you may see on TV or hear on the radio. So let's talk about erectile dysfunction. So what's erectile dysfunction? So erectile dysfunction is when a guy has a problem either starting or keeping their erection, essentially. And they're unable to have intercourse or to masturbate or any kind of sexual activity that provides them pleasure, right? And the reasons for erectile dysfunction are multifactorial, which I'll kind of talk about now. So when we look at how common erectile dysfunction is, if we look at this study where they examined men from 40 to 70 years old, and they looked at how common erectile dysfunction was. So how common is a 40-year-old to have erectile dysfunction, or how common is a 50-year-old to have erectile dysfunction? When you look at men that were 40 years old, they were found to have about a 40% chance of erectile dysfunction. Men that were 60 years old had a 60% chance of erectile dysfunction, and guys that are 70%. And when you looked at how severe the erectile dysfunction was, so this light gray area is mild, so just having some problems. The blue area is moderate, so maybe using a little bit of medication, and severe is no matter what I do, I can't get an erection. So as guys got older, they found that the severity of their erectile dysfunction became more and more of a problem, and that's just with age. Besides age, there's a number of other issues that can lead to erectile dysfunction. Some of these are diabetes, so high blood sugars, as well as vascular disease, so high cholesterol, hypertension, stroke, heart disease. All these things can also lead to erectile dysfunction. And then there's medications. And what we say about medications is, one, it's the collaboration of the medication as well as the disease that's causing the erectile dysfunction. So when we look at erectile dysfunction and cardiovascular disease, we kind of have to look back at this canary in the coal mine. So in the early 1700s, miners would bring these canaries into the coal mine to pick up dangerous gases. And so the canary, which was more sensitive to the gas, would die, and then the coal miners would notice that, and they would leave the mine after that happened. So the same thing is true with erectile dysfunction and cardiovascular disease. When we look at erectile dysfunction and we look ahead about 3 to 4 years, men with erectile dysfunction have a higher rate of cardiovascular disease. So that's heart attack and stroke, and it usually takes about 3 to 4 years to occur. So when you look at this graph here of the penile artery, so the penile artery, as you can see, is one of the smaller arteries in the body. So this is the penile artery here. This is the coronary artery, which is a little bit larger in diameter. This is the carotid artery, which is a little larger than that. So this is a depiction of a male that has erectile dysfunction. So as you can see, the diameter of the penile artery is really small. At that same time, you can see there's some closing of the diameter of the coronary arteries. But give it about 3 to 4 years, then the coronary artery starts to look like the penile artery, and guys then have a higher likelihood of having a heart attack. And then comes the stroke several years after that. Also in studies where they look at medications that are given for erectile dysfunction. So they'll look at a male that's been given Viagra or Cialis, and they follow that male throughout time. They find out within 3 to 4 years that male has a higher likelihood of being prescribed medications for their blood pressure, as well as medications for cholesterol. So let's talk a little about low testosterone. So low testosterone, as I mentioned, you probably hear about it everywhere. It's you hear it over the radio, you hear it on TV, and it seems like it's the panacea or the cure for everything. So what is testosterone? So testosterone is a hormone. It's the major male hormone. Actually, women have testosterone as well, but just in lower levels. So in males, it's made in the testicles, and it goes through the bloodstream, and then it attacks to these receptors or these gloves in different organs in the body. So in the muscles, it can increase strength and the volume of the muscle, and fat. It can actually decrease fat. Helps with stronger bones. And when it comes to sexual function, it can help with erectile dysfunction. So it helps with erection function. It can help with sperm production, as well in the brain. It can help with libido, mood, energy, etc. So when we look at men over time, so we look at men in their 30s compared to men in their late 70s, we see that testosterone decreases over that time. And it decreases for a number of reasons. The testicles may stop producing testosterone. There may be some obesity and medical problems that causes lower testosterone. But in large, you'll see a decrease in testosterone. And as guys see a decrease in testosterone, they start having some symptoms and signs of hypogonadism, or another word, as I mentioned, is low testosterone. Those signs are increase in body fat, reduced muscle mass, some issues with body hair. They can also have lower sexual desire for their partner, weaker and fewer erections, lower energy, depressed mood, as well as reduced muscle mass. These are similar symptoms that we might see in women as they go through menopause. So in women, because of decrease in estrogen as well as some decrease in their testosterone, they may also have some problems such as lower libido and problems with orgasm. So now I want to talk about some tips, some health care tips to improve erections as well as to help to increase testosterone. And the purpose I'm giving you, the reason I'm giving you these tips is to help in terms of your erections, as well as for you to maybe avoid some visits to your urologist or your primary care doctor. By doing these tips at home, we can hopefully circumvent some of these issues with erectile dysfunction and low testosterone. So one of the biggest things that men as well as women can do is increase their physical activity. All right. So by increasing your physical activity alone, you reduce the risk of having a heart attack, you reduce your risk of having a stroke, your weight goes down, you have decrease in type 2 diabetes, as well as it can help with some cancers. And in my world, it can also help to improve and restore your sexual function. And this is for men and for women. So when we talk about physical activity and we ask, how much physical activity do I really need, right? And so there was a few studies which looked at men that exercise more than 2.5 hours a week. And that's it, 2.5 hours a week. Think of all the things you probably, most guys are on their phone more than 2.5 hours a week. So let's convert that over to doing more aerobic physical activity. So when men did that, they increased their scores. So when we look at erectile dysfunction, we look at these scores in terms of rigidity and able to maintain an erection. So when we increase the activity by 2.5 hours, we saw an increase in erection scores compared to men that had no physical activity at all. All right, you can say, Doc, listen, so I already have erectile dysfunction. My doctor's thinking about putting me on something like Viagra or Cialis, okay? So when we compared men that were just started on something like Viagra and Cialis versus men that were started on Viagra and Cialis plus exercise, the men that were started on Viagra or Cialis or any of those types of medications and exercise had more improvement of their erectile function. They had better erections, they had better initiation and better maintenance of their erections. So when we talk about blood pressure, you're like, Doc, okay, I got the high blood pressure. Like, what do I do? One of the best things that you can do is to exercise. So when you looked at men that had high blood pressure and they exercised between 45 to 60 minutes a day, they had improved erections as opposed to men that didn't exercise. And look at these guys in this picture. They look really happy exercising. They must be getting great erections. Diet. Diet's so important. Eating a healthy diet can do so many things. A poor diet can lead to obesity, as we all know, high cholesterol, heart attack, diabetes, stroke, cancer. All these things can starts with a poor diet. So the things that we shouldn't be eating, or at least we should try to reduce in what we eat, are things high in saturated fats, and those things are like bacon, cheese, all the things we love, cured meats, biscuits, trans fatty acids, which are cookies, margarine, fried food. All these things we should really be more conscientious and think about reducing, especially if we want to keep our erectile dysfunction, especially if we want to maintain our testosterone. So what do we eat? So when we look at areas in the world, especially these blue zone areas, so blue zone areas are areas where people live the longest, right? So there's some places in Sicily, there's some places like I believe in Costa Rica. These places are where people live the longest, And when you look at things that they have in common, so one of the things they have in common is what they eat, all right? And what they eat is more like a Mediterranean diet. So these are diets that are high in fruits, more whole grain, vegetables, nuts, legumes. And in these areas, they also reduce their red meat consumption. The processed meat, they eat hardly any processed meat, and they increase their fish intake, so those fatty fish like salmon and things like that. When you look at those diets and you look at health, you find that with these diets, these men have a lower risk of coronary artery disease, they have a lower risk of high blood pressure, lower risk of atherosclerosis, a lower risk of diabetes, you name it. You know, diet is so fundamental to our health as well as to our sexual function. So what about the Mediterranean diet when it comes to erectile dysfunction? So men that have something called metabolic syndrome. So metabolic syndrome can be men or women, but in this study they looked at men. And in this study, so metabolic syndrome, let me go back. Metabolic syndrome is a correlation or combination of symptoms of obesity, high blood sugar, hypertension, cholesterol, etc. And it leads to a higher rate of cardiovascular disease as well as erectile dysfunction. So men with metabolic syndrome that were placed on a Mediterranean diet, right, they had better function of their blood vessels, they had less of these inflammatory markers in their blood, as well as they had improved erections compared to men that were on a regular diet or more of an American diet with saturated fats, etc. So when we look at diabetes, so men newly diagnosed with diabetes, and when you look at men and women, and you look at sexual function, so men and women that were newly diagnosed with diabetes that adhered to a Mediterranean diet actually had reduced sexual dysfunction as compared to men and women that did not adhere to a Mediterranean diet. All right, and then so let's look at men and women that adhere to a Mediterranean diet, and we look at glucose control, if we look at cholesterol, if we look at erections. And if we give these guys a scale, so if we give them a scale of 0 to 9, and 0 is they don't adhere to a Mediterranean diet at all, and 9 is they're adhering to it to the T, we find that guys that are on a scale of 6 to 9, so, you know, their diet has some saturated fats, but mostly they're adhering to a Mediterranean diet. These guys had much better glucose control. They had much better cholesterol. Their erections were much better than guys that didn't. So smoking. As we all know, smoking can affect every organ in the body, and it can also affect the penis. So smoking doesn't only affect the person that is smoking, but it also can affect their neighbor. So secondhand smoke can also affect erectile dysfunction. So it's not only the amount that men are smoking, but it's how long they're smoking. So if a man is smoking for 30 years and smoking 2 packs a day, they're going to have more severe erectile dysfunction than somebody that's smoking for a shorter period of time. So smoking damages the arteries, it accelerates atherosclerosis, increases your rate of stroke, heart disease, lung cancer. So many things are related to smoking, including erectile dysfunction as well as some issues with testosterone. So what if I stop smoking? So what do I tell guys that come into my office and they've been smoking for a long period of time? I tell them that in studies where men stop smoking for 1 year, they'll have a 25% increase in those erectile dysfunction scores. So their erections will be harder, more rigid, better able to initiate and maintain their erection, 25% better than when they come in my office. But also, even in the short term, in some studies, we see that over just a couple of days, we'll see that men who stop smoking, their rigidity actually becomes better. They have better maintenance of their erections just in that short period of time. So medications. So before I talk about medications, I just want to highlight that if you're on any of these medications, I don't want you to stop. what I want you to do is talk to your provider. Let them know that you heard this talk here and that you're on one of these medications, and these medications may be contributing to some of your erectile dysfunction. All right. So as I mentioned, I don't want you to stop any of these medications. I just want you to be aware of them. So some of the medications that we use for high blood pressure, such as beta blockers, they go by metoprolol, propranolol, or atenolol. There's some diuretics, so some water pills that are hydrochlorothiazide is one of them. These can all lead to or worsen erectile dysfunction. Other medications like antidepressants, such as Lexapro or Paxil, what they can do is they can lower your libido. They can lead to prolonged orgasms, but they can also lead to erectile dysfunction. And there's a host of other medications that are given for either issues with epilepsy or reflux. Some of these medications can also contribute to erectile dysfunction. So it's something that you can talk to your physician about. But as I mentioned before, I don't want you stopping these on your own. So there's other factors that contribute to erectile dysfunction. They're alcohol. So excessive alcohol use can cause some issues with the testicles and lower testosterone, but it can also cause ED. Depression. Depression is common in African American men and women, and I think we need to do a better job of seeking help. But that can also lead to sexual dysfunction. It can lead to lower libido. It can also lead to erectile dysfunction, and then obviously diabetes. And we talked a little bit about that. So the other question is, how do I improve my natural testosterone? As I mentioned, there's so many things on TV where you see these athletes that are on TV and they say, listen, like if you want to look like me, if you want to act like me, if you want to be as manly as me, take this pill. But there's things that you can do to increase your natural testosterone. So maybe you can avoid some of those things. So one of the best things you can do is lose weight. Okay, so unfortunately, African Americans are 20% less likely to engage in physical activity. That means if you're strolling through the park, you're 20% less likely to see the guy next to you, walking next to you, playing tennis, jogging, what have you. And we need to do a better job of physical activity as well as some weight loss. As we know, obesity is associated with diabetes, it's associated with heart disease, stroke, cancer, as well as erectile dysfunction. And then we talked about low testosterone. So this is a great study which shows the effect of testosterone and how weight is affected by it. So this is a study that looked at about a little bit over 2,000 men. And here on the x-axis, you'll see percent in weight change. So this guy is lost 5% of his weight, 10% of their weight, and then 15% of their weight. And then they looked at what it does to the testosterone over time. So, for instance, this person here lost 5% of their weight, and they gained 14 nanograms per deciliter of testosterone. If you lost 10% of your weight, you would gain about 58 nanograms per deciliter of testosterone. But as you can see with this graph, it starts out slow, but then it really accelerates. So at 15% of someone's body weight, they'll gain about 172 nanograms of testosterone. This is probably better than any pill that you can take. So weight loss does so many things, and one of them is actually increasing your testosterone. So sleep. Sleep is very important. So we know that when you restrict sleep, all right, then you decrease testosterone. And it does matter when you're restricting the sleep. So this study here looked at if you restricted the latter part of sleep, so from 12:30 to 5:30, or if you restricted the beginning part of sleep. So we found that there was a decrease in testosterone when you restricted the latter part of sleep. So if you have a choice of either staying up late or waking up early, your bet is if you don't want to reduce your testosterone, is to stay up a little bit later and sleep throughout the morning. Another thing that's an epidemic in the African American community because of obesity is sleep apnea. So sleep apnea is a sleep disorder where breathing stops and starts throughout the night. There's a lot of symptoms of this. Men and women can have some problems with snoring. They can wake up and they're not refreshed. They can have some difficulty concentrating. So this is a study that looked at Black men in a study. They looked at about 850 Black men, and they found that over a quarter of them, or a little less than a quarter of them, had sleep apnea. They didn't even know about it. 5% of them were diagnosed by a doctor, and the rest of them didn't know they had sleep apnea, and they would probably suffer the consequences if they weren't diagnosed. So untreated sleep apnea is associated with diabetes, high blood pressure, kidney disease, heart disease, stroke, and of course, since I'm talking about sexual health, it's associated with lower testosterone as well as erectile dysfunction. So correcting sleep apnea is really important because we know that the greater the degree of decrease in oxygen, so the more times you stop breathing at night, the more your testosterone goes down. All right. So in this study, what they did is they corrected that, and they found that by doing this surgery or even using a CPAP machine, that testosterone would actually increase after you corrected the sleep apnea. So really important that we recognize sleep apnea. We try to avoid all the negative effects of heart disease and stroke, but we also can increase our testosterone so we can have better function, better sexual function. One of the last things that we can do to increase our testosterone is really resistance training. So we talked about cardiovascular health in terms of physical activity, about at least exercising 2.5 hours a week, which I think is the bare minimum. We should really be exercising more than that. But also, we should spend some time in terms of resistance training. That means lifting with weights. If we do that, if we do high repetition, so we're doing a number of different reps, and we're adding some weight to that, we'll also increase our testosterone, we increase our growth hormone, we increase our cortisol to lead to better sexual function. And I tell guys in terms of what to lift, because guys will go to the gym and they only want to focus on their chest and their biceps. Those aren't really big muscle groups. So we want the bigger muscle groups. So the bigger the muscle groups, the better bang we get out of our testosterone. So what we want to do is we want to work on our back, which is most men, when they work on their back, it's the whole back. Or we want to work on our legs, because the legs is another big muscle group that we work all together. And so by doing that, we get big muscle groups, so we get a better increase in testosterone, we get a better increase in our growth hormone, we get better sexual function because our testosterone's better, we get better erections because we're exercising. All of these things kind of work together in terms of improving our sexual health as well as improving some of those outcomes that I had discussed before. So the summary in improving our natural testosterone is, once again, it's losing weight, improving sleep, treating sleep apnea. We want to do some weight resistance training, as well as, I didn't mention this, but also decreasing stress. So as African Americans, we have stressors coming from every different direction. We do know in studies that when stress levels are high, testosterone goes down, sexual function goes down. So we have to find ways to alleviate some of that stress. And it's different for everyone. If it's physical activity, if it's talking to our friends, whatever it might be, to decrease our stress in our lives, it's really going to help our sexual function. Even talking to your partner about any of these things can also help. So in conclusion, I hope that I've conveyed that Black men in general, we really need to do better with our health. And obviously, as I mentioned, there's a number of reasons why our health statistics are lower than a lot of other populations, because of the inequities, because of education, and a number of things. But there are some things that we can do to help ourselves to prevent or at least decrease the rate of cardiovascular disease, and as well as to improve our sexual function. And so this is where I'm going to conclude. And I really hope that you'll enjoy the summit that we have here. There's a lot of bright speakers that I just hope that you can just take just a little bit of from every talk and somehow combine it with some of the things you're already doing, improve some of improve your health. I want to try to get you guys out of my office. When guys come in my office, it's usually when they've been having some sexual problems, either erectile dysfunction or low testosterone for quite a while, or even women that are coming into the office and they're having some issues with sexual dysfunction, menopause. These are things that we should really try to prevent and to really try to combat early, especially these symptoms. There's no reason why anybody should be suffering with any of these things. So I want to thank you for listening. You can follow me at Dr. Gittens on Instagram, and our Facebook page is at Dr. Gittens. Thanks, and hope to see you next year.